There's a lot of fear in coming back to school. I'm a 40-year-old man that walked in there to get his high school diploma. It was very hard for me, but one of the teachers was Miss Araceli. She gave me direction. Every single time I had a question, she'll put down whatever she's doing and she'll sit there with you until you get it. 50% of getting your high school diploma is walking through those doors. The other 50% is doing the work.
Find free adult education classes near you at finishyourdiploma.org.
For months, I've been fighting to get more vaccine for Monterey County and helping thousands of essential farm workers get their shots. Today was my turn. Getting vaccinated is how we will end this pandemic, but it's also important to me personally. I've been away from the people that I love and miss, and I have family and friends who have been hit by the virus. If you are eligible, please get your shots. The vaccines are safe and effective. Make your appointment or call 211 for help. Let's fight COVID together by getting vaccinated. We are Monterey County Strong. Durante meses he estado luchando para obtener más vacunas para el condado de Monterey y ayudando a miles de trabajadores agrícolas a vacunarse. Hoy fue mi turno. Vacunarnos es la forma que acabaremos con esta pandemia, pero también es importante para mí personalmente. He estado lejos de personas que amo y extraño y tengo familiares y amigos que han sido afectados por este virus. Si es elegible, vacúnase. Las vacunas son seguras y eficaces. Haga su cita o llama a 211 para obtener ayuda.
It's a short ride from your neighborhood to your naturehood. Find fun activities to do, like boating and biking, or camping and hiking, plus much more. To find a neighborhood park or green space near you, visit discovertheforest.org.
Play Eric Amarola's Race Day Mix.
There's a lot of fear in coming back to school. I'm a 40-year-old man that walked in there to get his high school diploma. It was very hard for me, but one of the teachers was Miss Araceli. She gave me direction. Every single time I had a question, she'll put down whatever she's doing and she'll sit there with you until you get it. 50% of getting your high school diploma is walking through those doors. The other 50% is doing the work.
Find free adult education classes near you at finishyourdiploma.org.
For months, I've been fighting to get more vaccine from Monterey County and helping thousands of essential farm workers get their shots. Today was my turn. Getting vaccinated is how we will end this pandemic, but it's also important to me personally. I've been away from the people that I love and miss, and I have family and friends who have been hit by the virus. If you are eligible, please get your shots. The vaccines are safe and effective. Make your appointment or call 211 for help. Let's fight COVID together by getting vaccinated. We are Monterey County Strong. Durante meses he estado luchando para obtener más vacunas para el condado de Monterey y ayudando a miles de trabajadores agrícolas a vacunarse. Hoy fue mi turno. Vacunarnos es la forma que acabaremos con esta pandemia, pero también es importante para mí personalmente. He estado lejos de personas que amo y extraño y tengo familiares y amigos que han sido afectados por este virus. Si es elegible, vacúnase. Las vacunas son seguras y eficaces. Haga su cita o llama a 211 para obtener ayuda.
It's a short ride from your neighborhood to your naturehood. Find fun activities to do, like boating and biking, or camping and hiking, plus much more. To find a neighborhood park or green space near you, visit discovertheforest.org.
Play Eric Amarola's Race Day Mix.
There's a lot of fear in coming back to school. I'm a 40-year-old man that walked in there to get his high school diploma. It was very hard for me, but one of the teachers was Miss Araceli. She gave me direction. Every single time I had a question, she'll put down whatever she's doing and she'll sit there with you until you get it. 50% of getting your high school diploma is walking through those doors. The other 50% is doing the work.
Find free adult education classes near you at finishyourdiploma.org.
For months, I've been fighting to get more vaccine for Monterey County and helping thousands of essential farm workers get their shots. Today was my turn. Getting vaccinated is how we will end this pandemic, but it's also important to me personally. I've been away from the people that I love and miss, and I have family and friends who have been hit by the virus. If you are eligible, please get your shots. The vaccines are safe and effective. Make your appointment or call 211 for help. Let's fight COVID together by getting vaccinated. We are Monterey County Strong. Durante meses he estado luchando para obtener más vacunas para el condado de Monterey y ayudando a miles de trabajadores agrícolas a vacunarse. Hoy fue mi turno. Vacunarnos es la forma que acabaremos con esta pandemia, pero también es importante para mí personalmente. He estado lejos de personas que amo y extraño y tengo familiares y amigos que han sido afectados por este virus. Si es elegible, vacúnase. Las vacunas son seguras y eficaces. Haga su cita o llama a 211 para obtener ayuda.
It's a short ride from your neighborhood to your naturehood. Find fun activities to do, like boating and biking, or camping and hiking, plus much more. To find a neighborhood park or green space near you, visit discovertheforest.org.
Play Eric Amarola's Race Day Mix.
a lot of fear in coming back to school. I'm a 40-year-old man that walked in there to get his high school diploma. It was very hard for me, but one of the teachers was Miss Araceli. She gave me direction. Every single time I had a question, she'll put down whatever she's doing and she'll sit there with you until you get it. 50% of getting your high school diploma is walking through those doors. The other 50% is doing the work.
Find free adult education classes near you at finishyourdiploma.org.
For months, I've been fighting to get more vaccine from Monterey County and helping thousands of essential farm workers get their shots. Today was my turn. Getting vaccinated is how we will end this pandemic, but it's also important to me personally. I've been away from the people that I love and miss, and I have family and friends who have been hit by the virus. If you are eligible, please get your shots. The vaccines are safe and effective. Make your appointment or call 211 for help. Let's fight COVID together by getting vaccinated. We are Monterey County Strong. Durante meses he estado luchando para obtener más vacunas para el condado de Monterey y ayudando a miles de trabajadores agrícolas a vacunarse. Hoy fue mi turno. Vacunarnos es la forma que acabaremos con esta pandemia, pero también es importante para mí personalmente. He estado lejos de personas que amo y extraño y tengo familiares y amigos que han sido afectados por este virus. Si es elegible, vacúnase. Las vacunas son seguras y eficaces. Haga su cita o llama a 211 para obtener ayuda.
It's a short ride from your neighborhood to your naturehood. Find fun activities to do, like boating and biking, or camping and hiking, plus much more. To find a neighborhood park or green space near you, visit discovertheforest.org.
Play Eric Amarola's Race Day Mix.
Hello, everyone. Thanks for joining us for the media briefing on this Wednesday. We're going to start with COVID-19, and if anyone out there has been watching hospitalization numbers, they certainly have a lot of concerns, and we're very pleased to be joined by representatives from some of our area hospitals today to talk a little bit about that issue. And let's start with Dr. Podell from Salinas Valley Memorial Healthcare System. Thanks very much, Dr. Podell, for joining us today. We've had you on last month, and you really gave us some great insight into the variants, and we're hoping you can talk a little bit about the variants and hospitalizations today.
Sure. First of all, thank you very much for letting me participate in this media conference. A month ago, we met, and what we talked about was there were a handful of Delta variant cases in our Monterey County. But as of today, our new cases of COVID-19 seem to be around 90% Delta variant. So it didn't really take very long for this Delta to take over most of the infections. What that means is this virus is highly, highly infectious. It's really fit for transmission, especially in the unvaccinated population. So, as of last few months, we had very few patients in our hospital, and everything looked like it was near normal. The pandemic felt like it was ending, but recently we have seen increasing number of new diagnoses of COVID-19, increased hospitalization, some of which are very critically ill patients on ventilators, and we have had few patients die from COVID-19. So the trend is not what we want to see and what we're hoping right now. Most of the hospitalized patients who are extremely sick seem to be unvaccinated. So really this has become the pandemic of the unvaccinated population.
Thanks very much, Dr. Podell. We're also very pleased to have Dr. Martha Blum from Community Hospital joining us. What is happening over at Community Hospital? And I'm hoping you can also talk a little bit about the importance of vaccine if what Dr. Podell is saying is true, which is it's a pandemic of the unvaccinated. Can't we solve this? And I can't hear you. Dr. Blum, I can't, going to give that a try? She may be regrouping. We're also pleased to have Dr. Craig Walls from Natividad on. Good afternoon.
Hi.
And I'm wondering if while Dr. Blum is regrouping, can you tell us what's happening at Natividad with COVID-19?
I can. So as Dr. Podell said, we were enjoying 0, maybe 1 patient for quite a few weeks. And we're up to 7 patients today with COVID-19, which is heading in the wrong direction, as Dr. Podell said. And I can tell you that the folks that we're seeing sick enough to be hospitalized who have received any vaccination, even 1 of 2, is vanishingly small. The vast majority are folks who have been unable to get the vaccine. A colleague was recently pointing out to me that, reminding me rather, that not vaccinated is not the same as anti-vaccination. There are folks for whom it has been a challenge to get the vaccine for one reason or another. They have trouble getting out. They don't have access. They don't have the communication, the understanding of where to go, et cetera. So I think we need to redouble our efforts to get vaccine into folks' arms. I think a lot of people who maybe were waiting are now ready. And what's really heartbreaking, and I know the other two doctors will echo me on this, is folks that are showing up to the hospital very sick, asking for the vaccine, and we it's too late. We don't vaccinate folks who are acutely ill with COVID-19. So I would just urge the folks on this call to help us message the primary importance of vaccination, protecting not only yourself, but your loved ones.
Thank you very much, Dr. Walls. And let's see if we've got audio on Dr. Blum. Nope. We have got some audio problems with Dr. Blum. That is so unfortunate. You know,
can you hear me now?
We sure can.
Okay. All right. We'll give this a try then. Unfortunately, I have to echo exactly the same things that are happening at the other hospitals are also happening at Community Hospital. We had a very nice, quiet month of June. Unfortunately, very first week of July, we saw a sharp increase in hospitalizations of people with symptomatic COVID. Unfortunately, several of them required ICU level care. And so far, we've had 2 people pass away from COVID-related illness in the month of July. That's after 4 months with no COVID-related fatalities at our hospital. So we are also running a daily census of between 5 and 6 active COVID cases at the hospital. And so far, since vaccines have become widely available, 95% of our hospitalized COVID patients have been unvaccinated. So it is very much the same as we're seeing elsewhere. It's the unvaccinated are particularly susceptible to severe disease. And we expect that to continue until we can get more people vaccinated. And yes, even people who've had prior COVID infection, we do recommend that as soon as they're done with their isolation period, that they go and get vaccinated, because we really don't know how durable or strong the immunity is after having an infection. But we do know that after vaccination, so far, the immunity from the vaccine is quite effective. Again, upwards of 95% of people are protected against severe disease. And that immunity also appears to protect people from the more transmissible Delta variant. So right now, the strongest and most effective tool we have to protect ourselves and our community against COVID-19 is vaccination. So I really can't urge people strongly enough, if they haven't been fully vaccinated, to go out and start the process now. And for those who maybe have started the process but are awaiting that second shot, be sure to schedule that second shot and get it done.
Thank you very much, Dr. Blum. And then before we move on to our next topic, any last words from any of you on vaccine or Delta? Any last encouragements?
Yeah, sure. Let me just add something to Dr. Blum has said. I think, I 100% agree with her recommendation. And, right now we're seeing the wrong trend. And with this extremely infectious virus circulating around and still a large number of unvaccinated population, we really want to make sure we protect the vulnerable people so that they don't end up in the hospital extremely ill. So since we have these extremely powerful tools of vaccines to protect yourself, please, I would encourage everybody to get that message out that these vaccines are highly effective, they're extremely safe, so go ahead and get your vaccine so that you can protect yourself. Otherwise, I think the Delta variant will find you.
Well, we don't want that. Thank you three very much for joining us today. If you're able to stay on the call for some questions, that would be terrific. We're going to move on to another topic, the alternate housing program. And really, that program was designed for people who were COVID positive or awaiting test results and needed a place to isolate. The program had gone down to nearly nothing. And it's really a snapshot of what's happening in the community, because now people are in need of the program. So we're very pleased to have Deb McElhaney and Lauren Suwansupa from the Department of Social Services to talk with us about what's going on with the program, what's available, and then also hopefully some safe isolation tips for people who may be experiencing COVID-19 now.
Thank you, Maya. Thank you for inviting us. So Deborah and I are from the Department of Social Services, but this really has been a county-wide effort in supporting alternate housing options for people who need a safe place to isolate. So the program is for those who are COVID positive or presumed positive. The program offers a safe place for them to isolate in a private area, and gives them access to some services that Deborah's going to share a little bit more about. We, as Maya had said, had been operating this program since really the beginning of the pandemic and had seen our numbers really dwindle down. But as your previous guest had mentioned, the surge that we're seeing, we're seeing that as well in our program, and numbers have been going up. So just really reminding people about the accessibility of this program for those who are homeless and don't have any other options of a place to isolate, those who may be in crowded housing in which safe isolation is just not feasible. This program is available to ensure that you're able to isolate and not spread COVID to your family, neighbors, and friends. I'm going to turn over to Deb to share a little bit about what the program offers as far as services go, as well as what safe isolation means for our program's purposes.
Thank you, Lauren. Good afternoon, everyone. And thank you, Maya, for providing us a platform to be able to talk about the services that we offer. I can absolutely relate to the doctors who shared previously about, we looked really good there for a while, and a lot of us were looking forward to these numbers staying low and going back to our regular jobs and our communities kind of getting on with their lives, and all of us healing from this COVID pandemic. But unfortunately, our numbers are back up. I can just share with you our numbers within a 2-week period that we were at 1 at our main site, which is what we call Operation Oasis. And it is a park that has approximately 10 trailers right now that are up and active, and where people can stay to serve out their isolation. It sounds terrible, huh? Serve out their isolation, but be able to safely isolate through the COVID isolation period that the health department sets for them. It's a really nice environment, as you all know, and I'm probably speaking to the choir, is that this is a great place for people to be able to relax and heal. And as we were moving through the months, we were thinking, oh, the vaccinations are going to really be a game changer, and they really were for a while. But unfortunately, now our numbers within 2 weeks went from 1 to 22. We were serving folks at our main Operation Oasis site, and then also people who were doing some safe home isolation, which I'll get to in just a second. I would say 5 out of those 22 were vaccinated, and they still were able to contract COVID, but their symptoms were near nothing. The majority of them didn't even realize they were COVID positive until they were tested for some other strange reason like travel or starting a new job, something obscure like that. And then they're like, oh my goodness, really? I didn't even know. And, but we do currently, and this has been a story throughout, but just recently we have 2 people who were unvaccinated who were sent to the hospital right now, and they are struggling. They came to the park first, and we convinced them to go into the hospital, and thank goodness we did, because as the doctors told us, the symptoms are pretty severe for the unvaccinated. So we do have other people who are suffering significantly, but not at the level where they need hospitalization. So this variant, I would have to say, based on my year and 4 months of experience of serving those who are COVID positive, is pretty gnarly, to put it in layman's terms. It's a bit scary to watch it unfold right in front of us. So I think I'll just go ahead and move over to the safe home isolation practices that and information that we share with the public. When we have someone who gives us a call, they're typically scared, or they're like, oh my gosh, I don't really want to leave. I have children, or, I don't really want to leave my house. I think I'm okay here. When we hear, we think we're okay here, or I think we can safely isolate, that really kicks us into the gear of like, okay, let's talk about what home isolation means. And we go through a series of questions with them, pretty much just a discussion. But what we help them realize is that their situation might not be safe, that there might be something that they need to think about, such as if they share a bedroom, even with a mask on, you can transmit COVID, sharing bathrooms, spending any length of time in there, going out of your room to cook yourself something to eat, and now you've shared the air with the rest of your housemates. And just even how tough it is to try to safely isolate as a parent when you have children, because they always want you. They don't understand that, mommy's in there for a really good reason. And they're always trying to get it. It's just very hard on a household and a family. So this is why we offer up this discussion, and then maybe help the family think about, okay, what's the next best thing that they can do? We can support them in their home isolation, and then we can also have them come into our alternate housing sites programs, where they are provided a great place to be able to isolate that has all the full amenities. They have their own place in one of the travel trailers or a motel room. And of course, then they have their own shower. We deliver 3 meals a day. They have initial medical assessments, and then ongoing daily check-ins from our RN who serves our program. And this has proved really a lifesaver, truly. I'm not just speaking figuratively here. Our staff and our regular alternate housing site program staff and our RN working hand in hand, and they know the symptoms. So what we can offer is the place where you can go relax, get better, have a support team behind you that is also looking at you from a medical perspective. So along with all that, and just feeling safe that I'll get through this, I'm okay. What we also offer up is a reconnection back to social services programs if you need that, transportation to any kind of appointments that you might have, access to equipment to continue telehealth appointments, or even newly established behavioral health appointments. We offer, if you have animals, you can bring your animal with you. Of course, there's rules around that, but we work with people, and we work with the SPCA, who also supports our efforts with people bringing in their pets, because many people will not come in unless they're able to bring in their pets. And laundry facilities, you name it, all they have to do is ask, and we try to figure it out for them if we can. I think that is it for me. Do you have any questions? Or Lauren, do you want to expand further?
I think we do questions at the end, but I will just make sure to make a clarification of with the home isolation, certainly to provide some support and advisement on how to do that safely. But our program is really only able to offer a more intensive support for home isolation if you actually qualify for our Housing to Harvest program, which is limited to people who work in the agricultural industry. Otherwise, services for the general population are for our housing.
Right, and we will reconnect people to the VITA program, the community health workers who will reconnect or connect with those families that are out in the community that we cannot serve. So there is a pretty good network to support our Monterey County communities through their COVID experiences. Also, too, I want to add one more thing, that we have access to 3 stipends that we can potentially provide to people who do the safe isolation and also come into alternate housing. So, and they're not anything to scoff at, because they're $1,000 a piece if the person qualifies.
So not to have anyone deterred over how to navigate all of those things, they can just, to reach out to the program, we can help navigate what they may be qualified for.
All right. Thank you both. This is great information. I'm so sorry to hear that your numbers have gone up. And hopefully if you would stay on the line for questions after all of our presenters, that would be terrific. Now we're going to turn to Car Week, which is just around the corner. And Car Week, while loads of fun, makes it very challenging for local residents to navigate around the county when all these activities are happening. And we've got Frida Escobar from our Housing and Community Development Program to tell us what's happening with Car Week, which is next week.
Hi, Maya. Hello, everyone. Thank you for having me and giving me the opportunity to showcase our wonderful map and tools. My name is Frida Escobar, and I am the permit coordinator with Community Housing and Development Department. And as Maya indicated, yes, Car Week is ramping up, and we have our permits in process. I'd like to take this opportunity to showcase the map that we have. It's interactive. Let me go ahead and if I could share my screen. Okay, can everyone see the map? Can you see it, Maya?
Yes.
Okay, so this here is our interactive map, and it tabs out actually the months, but obviously this is what we have going on in July. But as we start to move into August is when Car Week it will be happening. We have a special tab here specifically dedicated for Car Week. If you click on this particular tab, and I will add the link in the chat in a few minutes, this basically will give you the information on the events that I and my team are aware of. Let me bring it up here. And here it takes you through the events with regards to Car Week, gives you the dates, the names, and what have you. And as we start going through the actual weeks, or excuse me, the days of Car Week, we have a special week for that. August 1st, we have the Pasadena event happening, and then it goes into August the 8th, the 7th, the 8th, the 9th, and here the 10th is where it starts picking up, the 11th, and then there's a tab down. But I want to bring your attention to when you're viewing this map and you're deciphering which event you'd like to go to, you can click on to any one of these. For example, let's look at the Pebble Beach one. You can click on that. It'll give you the number which corresponds to the location on the map. If you scroll down here, it gives you some information, and then also will indicate if there is a permit that is required, if it's processed, if it's issued, or if it's an event within a city limit that is we wouldn't be permitting that particular event. That would be that appropriate city. But for this particular one, if you look at number 3, you would just click on the number 3, and then it would give you where, again, what the event is and the location. And you can go ahead and do that within the map, which is really, really pretty cool. Another feature that we incorporated this year, you'll see these little arrows throughout the county, and there are various areas, as you can see. This will give you some live traffic information. For example, if we go ahead and we click on this particular one, and then you click on info, here you will have live traffic. This is something that we partnered and we're streaming with Caltrans. So when folks are moving around the county and they're going from event to event, they'll be able to go on here and check live traffic. And again, this is through Caltrans. Might take a little while to, as far as the buffering goes. So yeah, that's it. Currently we have, let's see, we have about 10 applications currently in process that are going through. These are the larger events. We have been in close communications with CHP as well as the Sheriff's Office to ensure traffic plans are in place. Life, health, and safety is the #1 priority as we move through these. These events are getting larger and larger, so I really appreciate the coordination with the other agencies as well as the health department, making sure that the food vendors are permitted appropriately. And so we're really excited about this, and I just would like to give some kudos out to Dina Northcutt, my management analyst, who has partnered with Daryl Tyler from IT to make this happen. So we're hoping that folks utilize this and take advantage of this great technology tool that we put in place. Thanks.
Thank you, Frida. And I do know navigation around Car Week is really crucial. So bookmark that page so you know what's happening when you venture out for those days. So we'd like to go to our last participant for the briefing, last but not least. Very pleased to have Cindy Burnham from Hitchcock Road Animal Services. She's got some interesting information. There's always ebbs and flows with shelter intake, but Cindy, you say you've got some really high numbers, particularly with loose and aggressive dogs.
Yes, thank you, Maya. Hi, I'm Cindy Burnham with Hitchcock Road Animal Services, which is serving Salinas and Monterey County. And just for a brief intro, this is Dax. Dax is a 2-year-old min pin that came to us from South County, him and his brother Jax. So we have a match set. So he wanted to join me today. But we wanted to put out a reminder because we saw looking over our stats, some increases in numbers that were concerning to us. From April through June, we've seen a 50% increase in calls for loose, aggressive dogs in the unincorporated areas. So compared to January, February, and March, our calls are noticeably increased. So these are calls where somebody says, you know, I'm walking down the street and this dog chased me, is acting aggressive, or it attacked my animals or my livestock. And so we've definitely noticed that increase. 34% increase in barking dog complaints from the unincorporated areas as well. And then for the shelter part, we've seen a 62% increase from animals coming in from both Salinas and Monterey County in those months. And so while we don't have, you know, an exact cause, it does fall in line to summer vacations, people going back to work as things open up. And so we wanted to send a reminder to folks that while you're gone, or if you're now going back to work, it is still an owner's responsibility to make sure that they're keeping their folks like Dax here on their property, and especially if they've got some aggressive tendencies, because there can be some pretty serious repercussions. If your dog gets out and causes a car accident, kills or injured livestock, you can be held liable for that. You know, our pets have had us alone or home alone for quite a while with those that were working from home, and there's definitely a need to have a transition period if you start to go back to work, and our pets need that transition as well. We also just wanted to put some reminders. If you suspect your pet is lost, please come looking immediately. We have a texting program. You can text 831-LOST to 1-833-664-0513. And we've got that information on our website and social media. For barking dog owners, we just ask folks, if your neighbor comes and says, hey, while you're gone, your dog barks all day long, to listen to that, because a lot of times what we find is dog owners say, no, they're not barking, but you're not home when they're barking. So there's a lot of frustration with that. We understand that a lot of times we don't hear about it until you're at that level of it's driving you nuts. And so we just are asking for, you know, pet owners alike to be patient. We do have some tools that we can use if it gets to us, but we always recommend that folks, when safe and when possible, to reach out to their neighbors and hopefully can resolve it that way. And those are kind of the reminders we wanted. We're not alone, I think, in some of these increases around shelters around California, from what I understand. But, you know, it does come down to being a responsible pet owner and making sure folks like Dax here, you know, are home, they've got ID on them, they're microchipped, you know, the tools to use should they become lost. So that's what I wanted to share. Thank you.
Thank you, Cindy. And Dak seems pretty low key for being in front of the media and getting all this attention right now.
He is. He's great. He's very mellow. And even our notes on our evaluation said that he's just calm and collected. I have been feeding him little tiny pieces of cheese for my lunch. So that's helping too. But he's super nice and super calm. If you know, that calm dog that everybody's looking for, come meet Dax.
And Dax is available for adoption?
He is.
And his brother also, his twin?
And his brother, his twin brother, Jax and Dax.
Thanks very much, Cindy.
No problem.
All right, that's all of our presenters. So we're gonna go ahead and start with questions, and we've got quite a few in. So let's get started. And some of these questions may have been answered in the chat, but we have folks watching on YouTube and Facebook, and I'm going to go ahead and give the answers. How many, I think this is for you, Dr. Pudell, how many hospitalizations, COVID hospitalizations at Salinas Valley Memorial?
As of this morning, we have 7 hospitalized patients with COVID-19, and 3 of them are critically ill. And all of those have been either unvaccinated or not fully vaccinated.
Thank you. And then this question, I think, is for all of the doctors. How sick are the vaccinated patients that you have in your facilities?
At Memorial, we don't have any fully vaccinated patients. So I think based on the science, vaccinated people, either when they're infected with, especially the Delta variant, they're either minimally symptomatic or asymptomatic for the most part, but you can get breakthrough infections. And the evidence shows that they don't become critically ill and they don't get on ventilators. So at Memorial, like I said, we don't have any fully vaccinated patients.
Thank you. Dr. Blum, is that the same with community?
Right now, we don't have any fully vaccinated COVID-19 symptomatic patients hospitalized. When we reviewed, we've had only 5% of our COVID-19 admissions, so people sick enough to require admission to the hospital, only 5% were fully vaccinated. So 95% of our symptomatic COVID-19 patients have been unvaccinated.
Thanks very much,
right.
Dr.
And none right now. All of the COVID patients are unvaccinated.
Thank you. And I'm not sure if I'm not seeing Dr. Walls. Are you still on the call? I'm not seeing him. And I'll try to get information from him later to follow up. We can move along with some of these other questions. This is for all the doctors. Are each of the area hospitals requiring all their employees to be vaccinated or at least constantly tested?
I can speak to that. On July 26th, the California Department of Public Health and our state public health officer issued an order that healthcare workers in California will need to either be fully vaccinated or tested once or even twice weekly if unvaccinated. That state order goes into effect on the 9th of August and we need to be in full compliance by the 23rd of August. So we are currently working to build a plan to be in compliance with the state health officer's order. Of course, we have been highly encouraging all of our healthcare workers to become fully vaccinated, and upwards of 80% of them are at this point. So right now, that's the situation, and we're going to continue to get as many, if not all, of our healthcare workforce fully vaccinated or in compliance with the surveillance testing.
We are doing exactly the same at Memorial Hospital too, and around 80%, a little bit over 80% of our healthcare workers have been fully vaccinated. And like Dr. Blum mentioned, we're encouraging all our healthcare force to be vaccinated. We're making it easily accessible so that anybody who has not received the vaccine can get it very easily.
Thank you both. And I think that also answers the next question, which was what percentage of workers in each of the hospitals are vaccinated, which you both said about 80%. I don't know if you want to add a little bit more. How are you urging the unvaccinated employees to get the shot?
Well, for us, we are continuing to provide education as to the safety and efficacy of this. We're doing one-on-one interventions with unvaccinated workers who may still have some lingering questions or may have some health concerns. So we're really treating it with education and by making the vaccinations easily available. As we all know now, there is an abundant supply of the vaccines in the county, and we also do allow some allowances to get the vaccine done, you know, if they would need some time off because of some vaccine related side effects afterwards, those kinds of things. That what we did from the very beginning as we vaccinated the vast majority of our workforce, making all kinds of allowances and helping people to get through the full vaccination process.
All right, thank you both. Our next question is over to the alternate housing program. Which park is Operation Oasis?
Hi, that's at the San Lorenzo Park in King City.
And you know, I think additionally, maybe you could explain, you could share how the Operation Oasis is set up within the park, because the park is open.
Yes, the park is fully open. We have definitely reduced the size of our program, and we have 10 trailers now, and we are deep within the campground. And we're fenced off, completely separate from the park. So people can use the park for day use and enjoy it. And they have been all along. It's just now at a larger scale.
Thank you very much, Deb. Back to our doctors with some questions. Are you concerned that by recommendations for vaccinated people to wear masks indoors, that we're also removing incentives for unvaccinated people to get the shot?
Well, I think, you know, we're getting new evidence and data that even vaccinated vaccinated personnel can get infected with Delta, although they may be asymptomatic, but the level of virus in their nasopharynx is extremely high, maybe 1,000 times higher than the original variant. So what that means is they may not get sick, but they are still at risk of transmitting the infection to the unvaccinated or vulnerable population around them. So the science is really dynamic and it's evolving. And as we get more and more data, I think the recommendations are changing. I mean, I can understand the frustration, but it is really driven by the data that's coming out.
All right, thank you. And another question for both of you. Are we expecting a surge, or in your opinion, are we expecting a surge in the near future, a COVID-19 surge?
Well, I think I'll go first, Dr. Yeah, I do think, that we are seeing a surge. There's no strict definition of that, but again, comparing to the COVID-19 hospitalizations in June, July is a stark contrast and a clear increase, both in numbers and in severity. So yes. Now, we have the same pattern in 2020 that we had the easing of restrictions in May, end of May, and then we had a sharp increase in June, just a couple of weeks afterwards. So I think we're experiencing exactly the same consequences of the easing of restrictions in the face of not having complete immunity in the community. So yes, I think we'll continue to see more cases as long as we continue to have pockets of unvaccinated people. The good news is with a good portion of the population fully vaccinated, the absolute number of cases and the peak of COVID hospitalizations should be nowhere near what we experienced last summer, and certainly nowhere near the levels that we saw in December and January.
Yeah, I was going to say the exact same thing as Dr. Blum is we are already in the surge, and we expect to see increasing number of new patients and hospitalization, but probably not as bad as we saw in December, January, and February, for the reason that a large population has been protected with vaccination, and also probably the natural immunity is still there. When you add vaccine protection and natural immunity, we probably won't see as bad of a surge as we saw during the winter.
All right, thank you both. Continuing on with questions for the two of you, considering there seems to be very few breakthrough cases in Monterey County and 73% of residents here have gotten at least one shot, what percentage of the county's population should be vaccinated before the indoor mask recommendation for vaccinated people could be lifted, in your opinion or estimation?
I want to make one correction there. When we see the 73% with one dose of vaccine, that is not the percentage of the whole county population that's fully vaccinated. That is the percentage of the eligible population age 12 and up that has received at least a single dose. So we have 17% of our county population that's aged 0 to 11 and is currently ineligible for vaccination. So if you look at the percentage of 73% times 83%, that gives us 60% of the total Monterey County population that's gotten at least one dose. And again, one dose does not make a person fully vaccinated. So, when we start doing the math and really drilling down the numbers, we are probably maybe at about 50% of the Monterey County population that's fully vaccinated. So that certainly leaves us vulnerable, and we certainly have pockets and communities and neighborhoods where the percentage of vaccination of fully vaccinated individuals may be even lower than that. So it really is until we can get higher levels of immunity from vaccination or from natural immunity, we will be vulnerable as a whole county. And of course, we are a major tourist destination, so this doesn't even account for the people who may be entering our county as visitors from other areas and may themselves not be vaccinated. So right now, with this highly transmissible Delta variant, I think it is really wise for everyone to take stock of what their own health situation is, what the situation is of the members of their family, and take the proper precautions to protect themselves and those around them. And that should primarily be through vaccination, and then secondarily through other measures such as masking, physical distancing, and of course, as always, good hand hygiene.
All right, thank you. And then just a follow-up, you talked about people coming into the county, Dr. Blum. I have a question here. With the trend going in the wrong direction, as Dr. Bedell mentioned, are there concerns about the flood of people coming to the county for Car Week?
Again, we do know for sure that large gatherings increase the risk for potential transmission. Good news is outdoor events, the risk is much less. So I know many of the Car Week activities are outdoor activities, which should mitigate the risk. But again, anytime there are large group events, particularly if they're indoors, that increases the risk of transmission. And I know we had previously talked about there being super spreader events, but I just want everyone to sort of realize that with the new Delta variant accounting for 80 to 90% of all new infections, it is in itself a super spreader because it's so transmissible. So again, people will need to take appropriate precautions depending on their own health status, that of those around them and in their household, and what the circumstances are for whatever particular event it is that they're going to attend.
Dr. Bedell, would you agree?
100%. I think, although this event is happening outdoors, I'm sure after events could be indoors, like bars and restaurants are going to be crowded. So, we'll need to get that message as much as we can that, there's still plenty of Delta out in the community and that you protect yourself as much as you can.
All right, thank you. And then another question, slightly different topic for the doctors. Should we take our children to get tested if they have cold symptoms, if they are participating in summer camps or summer school or other summer programs?
That might not be a bad idea, especially if they're doing indoor camps. Because again, with predominant strain being Delta in our community, it's extremely transmissible. Children may not get very sick because they're resilient and they have good immunity, but it may be of value for contact tracing and making sure if anybody else whose immune system is not strong enough is being exposed, then they can monitor pretty closely.
Yeah, particularly any child who, of course, is unvaccinated, so those under 12 years of age, even mild symptoms could be indicative of COVID-19 infection. So yes, I would say, anyone with any symptoms that would be suggestive of COVID, including children, should be tested. And as a mother of two young school-age children, I can tell you that their summer camps, virtually all of them would require children who have symptoms like this to not come to camp until they had been evaluated and ruled out for COVID-19 infection.
All right, thank you, Dr. Blum. And our last question is for you, Dr. Blum. How sick were the 5% that were vaccinated at your hospital? Did they need oxygen or some other type of support?
3/4 of them required some COVID-specific treatment, and 1/4 of them, so that's of the 5%. So we're talking 4 people. So 1 did not require any treatment, and 3 of them did require treatment.
Thank you. And that is all the questions that I have. Wait, some are coming in. Another question for both of our doctors. Are all the hospitals reporting the similar incidents addressed earlier about critical ill patients asking for the vaccine? Dr. Walls mentioned patients came in ill and asked for the vaccine. At Salinas Valley and community, have you had the same experience?
At Memorial, yes, we have had a few patients, especially who have traveled from out of state, asking for vaccine when they're critically ill. But unfortunately, the outcomes were not very good. And, by the time they end up in the hospital critically ill, it's too late. And unfortunately, that would have been completely preventable if they have had that thought of getting vaccinated early on.
Yeah, we're offering the vaccination prior to discharge if the patients remain hospitalized long enough that they complete their isolation period in the hospital. So yes, in a few cases, we have been able to even offer them the beginning of the vaccine series before they leave the hospital, because unfortunately some of them have required fairly long hospitalizations.
All right, thank you both. And that is all the questions that I have on the briefing. Thank you all very much for joining us to talk about this really wide variety of subjects. I see Cindy Burnham is still on the line, and I'm hoping she can give us one last look at our friend Dax, who is available for adoption at Hitchcock Road Animal Services. Is Dax gone?
He is gone. He got a little fidgety. But
all right.
He is up for adoption on our website, hitchcockroadanimals.org.
All right, thank you. Ed, thanks everyone for joining us on the briefing today. Our next briefing will be next week, and we'll see you then.
Today on Community Cooking, we have guest chef Abby Grimion making a healthy twist on a classic spaghetti bolognese. We'll show you how to cut the carbs without cutting the taste. We're cooking with some of the best chefs from right here in our own community, so grab a seat and get comfortable. We have another great meal for you. This is your Community Cooking. Hi, and welcome to Community Cooking. I'm your host, Maria Prekachis, and I am excited to have guest chef and my friend Abby Grimion in the studio. Welcome.
Thanks for having me.
Well, and you're part of the City Cable family.
I sure am. I host Common Sense.
I love it. You also love to cook.
That I do.
Which, today I love your recipe because I love my carbohydrates, but I try to pick and choose. So I don't like 2 big carbs in a meal. So today we're tackling my fear.
Yes. So I love spaghetti squash. The thing about spaghetti squash that everybody gets wrong is that they're like, how do I open this? And like they go outside and like throw it over their head down on the concrete, Hulk smash. No, it's not. You can do that, but you know, it's a little fun to do that. But there's an easier way to do it and, you know, not make a mess.
Perfect.
So,
well, spaghetti bolognese, it's really simple. Tell me about the ingredients first.
So, you know, in that kind of keeping with the low carb, we use the meat of the spaghetti squash as our spaghetti base. We make a homemade marinara, and we also brown up a protein, and we put that all together, and then you have this really savory meal that is low on carbs but really big on taste.
And then some other veggies as well, which is great.
Yes, absolutely.
Carrots, red bell peppers.
So when we make the sauce, we use about 5 pounds of the of tomatoes that you can get from our Torrance Farmers Market. That I usually, when I do, I have to go ahead and boil them and then peel the skin off of them. If you don't have time to do that, it's always great to just grab it where it's already peeled in the can. So, and I love to use Roma tomatoes because I feel like those are always the best for sauces. They always just taste so good, and it doesn't have that mealy texture like some of the larger tomatoes do. So I use the tomato base. I like bell pepper. Some people really like a sweet sauce. I like my sauces a little bit more savory. So if you like the sweet, you can do the carrots like we have here, but then I also like to do a bell pepper instead. And then of course, onions. Onions are one of the big bases of a lot of sauces that we do all the time. So,
and then your lovely herbs.
Yes, I always try to use fresh herbs because I think, you know, it's like, sure, if you're on a budget or if you just don't have it in the kitchen, using the dried herbs is great. But if you have it fresh, and especially like if it's in the garden, yeah, just grab some and use it. So.
I love it. I love it. So let's tackle my fear of the spaghetti squash and cutting into it.
All right, let's do it. So.
We're not going to throw it on the ground today.
We will not.
Darn, that would have been fun.
That would have been fun, but we are not going to do a Hulk smash. So the easiest way to cut one of these spaghetti squashes, I take my fork and I start at the end, and I just start pushing little holes into it. And I basically make a perimeter around the entire squash.
Oh.
And because what it does is it releases the pressure, which is what makes it so hard to cut into if you just took a knife to it. So when you open that up, it makes it a lot easier to cut.
Oh my gosh, so you're not putting holes in it like a potato.
No.
It will explode supposedly in the microwave.
But you know what? I've done that a million times and it never does.
I know. Well, I haven't tried it, but so that is, oh, I never thought of that.
So, you know, you go ahead and you make the circumference around it, and I always like to have things even. So I went ahead and tilted it over this way to make sure that my line was straight. And I just keep making the line around the spaghetti squash. And then once I've done that, I also take my fork and I make a couple of holes on both sides. Because when you roast it, you want to have the steam to be able to have a way to escape.
Okay.
So, so I'll go ahead and finish with the holes.
That's like the biggest tip ever right there.
It really is. It's super easy to do. It's super clean. You know, you just grab your regular fork. You know, you don't have to have any fancy tools. And, you know.
That's good because my kitchen is not so equipped.
I don't believe that for a second.
I know I've been cooking more, which is good, and using a ton of these recipes, and of course getting all the beautiful fresh ingredients from the farmers market. So it's very fun.
Yeah, I love our farmers market. They have such a great variety of everything. You can get plants, you can get food, you can get the organic grass-fed beef. You can get everything.
A little bit of everything.
Love it. So we've made holes all around the spaghetti squash. Then I take my knife and I just go ahead and make a cut into it. Whee! All right.
You're like me. It comes equipped with sound effects.
Yes. So we're going to crack this open. And look at that.
Beautiful.
Then I just use my hands and scoop out
all the seeds.
And the reason why they call it spaghetti squash is if you look here, the meat looks like spaghetti.
Look at that, yeah.
I love it. It has the best taste. It's not really overpowering.
No, and like I said, I love it when other people make it for me, like you are today.
Yes.
But now I think the big thing is making a little pattern almost, if you will, with the fork and making it easier. And I really love if it doesn't go one way, go the other way, and it was much simpler.
Yeah, absolutely. Well, and the trick is like if you care to roast the seeds and have a nice tasty treat later, you can. But if not, you can just go ahead and discard it.
And then what you would do with this, now do you do it in the oven, the microwave, or you can do either?
Now most people use the oven, but especially in the summer here, it gets hot. So what I like to do is I like to cook it in the microwave, and you can roast it in the microwave, and it's super fast, and it just cooks up the same way.
Well, and we put one in the microwave with, and I'm going to grab it, with a little bit of water in it.
That's right. So you take your glass dish, you fill it up halfway, you put your squash face down into the dish, and cook it for 15 minutes on high. So then let's take a look at this. Wow.
Oh,
super tender.
Beautiful.
So then all you have to do is just
let it cool.
Let it cool.
Like we did.
And then just, grab your fork and just scoop it out. Look at that.
Oh, it's like spaghetti.
It is.
But it's so much better for you.
It's healthy spaghetti. It is stealthy healthy. I've made these for my friends' kids who don't like to eat healthy food, and they love it. So look at that. Fantastic.
And you get a lot out of it.
You really do. And here's the thing. When you cook it in the microwave like that, you actually get more out of it, out of the meat out of it, than you would in the oven. Because it's still kind of hard when you pull it out of the oven. So you get to kind of stretch it a little bit farther when you cook it in the microwave.
Like that.
And it's faster.
And 15 minutes.
15 minutes. So easy.
So a little bit of water, probably about a ½ inch. Straight down, microwave 15 minutes.
That's right.
And again, let it cool a little.
Let it cool, and then you can scoop out the meat.
Here, I'll get the very last bit while you heat up our pan for meat next. Oh, I'm dying to just scoop it up and eat it. It's so good. Squash is, the vitamins in it are awesome.
Squash is amazing.
Okay. So we have a spaghetti squash, that is, hence the name, because it looks just like spaghetti.
It sure does.
So, and then we have some lean ground meat.
And take your lean ground meat. I always like to use the 93.7 ground meat, the organic grass-fed kind. Put it in my pan and just break it up a little bit, and then salt and pepper to taste. So,
which we have.
So, just throw in
salt, a little pepper.
Actually, this salt is for our sauce that we're going to make in just a minute. So I'm going to grab some of this.
That's kind of a fun salt flake.
It really is a Mediterranean salt flake. You can get this at any kind of specialty store. So
and it's pretty.
It's very pretty. So I'm going to just toss
so if it's the 97.3, do you put any oil in the pan, or you just let the little bit of fat?
I just let the little bit of fat cook itself. So just season that, throw some pepper in there.
And I have to say, I'm addicted to fresh ground pepper now. I think it's the only way you can go.
I love fresh ground pepper. So good. So let our pan heat up, and then we're just going to go ahead and brown our meat.
And you could even, we could be doing the spaghetti squash while we're browning to save on time, because I like simple, and this is simple.
Super simple.
And colorful and healthy.
Exactly. Who knew? So we're going to let that heat up, and then we can start working on the sauce if you want.
Well, and I have to say, I meant to say earlier, the spaghetti sauce homemade from
Yes.
marinara, I didn't realize how much sugar. I mean, you can buy it or there are a lot of good spaghetti sauces out there. But making it from scratch, which I've actually done lately, it's so much healthier because you don't have the added sugar.
Exactly. I'm kind of a freak about what goes into my food. I like to control what goes into my body, so I make a lot of my own food. And I love that this sauce recipe is so easy. It makes a ton of sauce.
Yeah.
You can keep it fresh. It stays fresh in the fridge for about 2 weeks, or you can can it, or you can freeze it.
Freezing it's great. That's
yeah,
easy.
It's amazing, especially like, when it's a cool day, make a bunch of this sauce. Put it in the freezer, keep it for whenever the days get hotter, and then you don't have to heat up the house when you're cooking dinner.
Yeah.
It's easy.
That's one of my problems with no air conditioning. Honey, I like to cook, but it gets a little warm.
I get it.
And again, you used Roma tomatoes, you boiled them, peeled them.
Yes. So they are boiled and the skins are peeled. And so then we go ahead and we take those tomatoes and the onions, the bell pepper, and a little bit of salt and some olive oil, and we go ahead and throw that in the pan along with our fresh herbs, and we stew it down for about 2.5 hours.
Okay. All right, well, we're gonna let the hamburger, the lean ground beef, brown. We're gonna take a quick break. Don't go anywhere. When we come back, we're gonna do the sauce and your twist on yummy, healthy garlic bread. Don't go anywhere. You're watching Community Cooking.
Alexa, how do you tell if asparagus is still good?
If it's not moldy or slimy, it's okay to eat.
Enable the new skill from Save the Food on your Amazon Alexa and help fight food waste.
Hi, and welcome back to Community Cooking. If you're just joining us, we are taking a spin on spaghetti bolognese without the carbohydrates. Miss Abby, so happy you're here.
Yeah, it's good to be here.
So, hamburger,
yes,
done.
Our hamburger is brown.
Yeah, I'm like, that's done. I'm going off my checklist. Now let's go to the sauce with your fresh tomato sauce.
That's right. So we're going to start with a generous pouring of some olive oil.
Oh, we love that.
And to start out with our base, then after that we're going to add our tomato.
So you do olive oil, tomato, and then we cook the onions in that.
Yes.
As you said earlier, it will take a couple hours.
It will.
To cook it
so
all.
I'm going to carefully pour this in and not splash.
That's okay. We don't have to clean that.
Perfect. Okay. So then I'm going to throw in. What I like about this sauce recipe is literally you just throw everything in. It's so easy. You just throw it in and you pretty much forget about it.
A lot of chopped
Stir it.
onions.
Tons of chopped onions. My favorite, the bell pepper.
Or you could use carrots.
Or
but
carrots.
I'm going with what you like. So that's
yeah,
good.
I like a little bit more savory than sweet.
Okay.
If you're one of the ones who likes a sweet sauce, the other thing you can add to this is some honey.
Oh.
Yeah, so that way we're staying away from sugar. We're keeping everything all natural.
And I'm giggling because look at that mound of garlic. Gosh,
yes,
I love it.
We have to have the garlic. It's not a red sauce without garlic.
And you can chop it up yourself.
That's right.
Or
so,
use the store-bought. Shh.
So and I'm going to add just a little bit more of that olive oil. And we're going to stew this down. So this sauce takes 2.5 hours to cook. You put your heat on high, and you just let it, you literally just set it to go, stir it every once in a while.
Really?
And that's it. So by the time this is all stewed down, it's going to be nice and lumpy, but everything smells really good. It's super aromatic.
A couple basil leaves.
Yes.
Bay leaves.
The bay leaves are the important part, and the other important part to remember is that when you're done with this sauce, you have to get the bay leaves out. You don't want to.
You put them in, but you got to take them out.
That's right.
And then the herbs we have here.
So I'm going to grab just a handful of herbs.
And you don't have to chop them up or anything.
I usually like to because I feel like when you chop it up, you release all those oils, which is what really makes it taste great. So I'm going to take some of that.
Oh my gosh, I can smell those.
I love the smell of fresh herbs. There's really nothing better.
This is my favorite in salads.
Oh yes.
In
so
recipes,
just gonna
raw.
Chop everything up really kind of coarse.
Yeah, you're right. It does.
See, smell it.
Yeah.
It smells so good.
And so easy. I love that you throw it in the pot and you just let it go.
That's right. So maybe one more time. Gosh, it's just, I wish
so
everybody
good.
at home could smell just how good
I always say
this smells.
smell-o-vision. One day it will be here. You just
Smell-o-vision.
wait.
I can't wait. Can't wait for smell-o-vision. So we throw everything into the pot and we let it cook down for 2.5 hours. I'm going to turn
And
this
the
off.
beauty of television is you brought one. Now, first off, let me back up. You cook this for 2.5 hours. When do you add the hamburger? Or the ground beef?
We do the ground beef towards the end when we're about to plate it. So let this cool down.
Okay.
And then we go ahead and make everything for our sauce. Now, I've already made the sauce, and I put it on my handy Vitamix. As you can see, everything's really lumpy in here, but it's because it's stewed down for about 2.5 hours. So then I just go ahead and blend it. Look at how nice that consistency is.
Well, and it was lumpy because you used your own tomatoes and the aromas and all of that. That looks like what you get in a restaurant.
This is better than what you get in a restaurant because you controlled everything that went in it. It's all
sugar.
organic.
I love it.
No sugar, all the good stuff, none of the bad stuff.
So you blend it down and then you add the hamburger at the very end when we plate it.
When we plate it, we're going to go ahead and get our spaghetti squash. Then we're going to spoon out some of the sauce, throw the hamburger in it, and then we're done.
Oh, I love it. All right, well, we're not quite done because I always like to pick and choose my carbs. Instead of having two, I said earlier at dinner, I would rather have this and some beautiful bread. And we have all the ingredients here for your healthy garlic bread. Tell me about the ingredients we need.
Now, for my healthy garlic bread, I actually made this loaf of bread, and we're going to feature the recipe for this loaf of bread.
I love it.
On one of our upcoming episodes. So I have my homemade bread here.
Okay.
And this is the finished product.
How do you get that? Because I could just scoop it out.
It really is something you could scoop out. So this is going to be our garlic mash. So what I do is I take my heads of garlic. I'm going to
I'm just going to covet the bread for a moment.
And I go ahead and just cut off the top.
Okay.
And then I peel back all the skin. I want the head of the garlic exposed because I'm going to put it in a pan and roast it. But I'm also going to season it at the same time. What I love about when I roast these pods of garlic is that sometimes the actual pod will pop up out of it, and then you can just pick it up and just eat it. It's so good. Growing up,
good for you.
Oh, it's so good.
You have to make sure everyone at the party though eats it.
Yes, yes. There's no shame in having garlic breath when you eat this because it's
so good and good for you.
It's unapologetic garlic bread.
So we're going to take the garlic pods, as I like to call them.
Yes.
And then do you do olive oil? What do you put on top?
Yeah, so I'm going to go ahead and grab a pan and take my garlic pods and throw it in here. Cut that one more time to make sure that gets, there we go.
Oh, I love it.
Yeah, so we're going to cut this, peel that away. So then we're going to put it in our pan, grab some more extra virgin olive oil. I always like to douse it really nicely.
Okay.
And then I take some pink Himalayan sea salt, dust it on top. And then I like to use, if you don't have the fresh, you can just use your savory spice that, you would normally have.
Well, we're going to put this in the oven. Should I start cutting?
Yeah, let's go ahead and
you have
cut that bread.
Fancy dancy bread knife for me.
Yes, I sure do.
She knows my cutting skills. It has to be a good bread knife.
There you go.
So can you slice it in half and do it that way, or do you like making slices?
You can slice it whatever way you want.
How about just slice it individually?
Perfect.
So do we toast this first and then add, as I call it, the garlic marmalade, but it's not.
Whatever you prefer. If you want to toast it, then it's fantastic toasted. If you want to have it plain, it's okay too. So
I like toasting. So we're going to cut it like this and then put it on a cookie sheet, cake pan?
Yes.
To toast it? Yeah, I have to set that away from me because it would just...
So here you go.
Are these too thick, too thin?
No, it's
whatever
perfect.
you prefer. I like
no, if we're gonna have carbs, let's have
'em.
carbs. So.
And we just put them in.
Yeah, just put it in plain and toast it up nice and brown, and then you take your garlic mash. So when we grab that garlic out of the oven,
which I'm gonna grab that because you already brought some done.
Yes.
So continue on.
So when we grab that garlic out of the oven, you're gonna see how nice and pretty it is because it's roasted and it just looks and smells super yummy.
Look at that.
Wow, that is perfect.
Oh, I'll swap you.
Perfect. Now,
yum.
I'm gonna, so you can take this, first let it cool off a little bit. So that way you're not grabbing it with when it's super hot and burning your fingers. But if you look, I mean, it's perfectly roasted. This will melt in your mouth. So good. And what I love about this is that the hull just pops away.
All right.
Super easy.
So she says. Woo! That is yummy.
Mm-hmm.
But wait, we're going to do something with it.
Right. So let's grab a bowl.
We both had it, so it's okay. Woo! Let me tell you.
So we're going to peel away all of our garlic pods from the shell. Grab a bowl.
Oh my word. Hello.
Throw the garlic in there, and then we're just gonna mash it up with a fork. It's so super easy. Because I like that kind of chunky consistency.
Oh yeah. So you mash it up, because we already added the herbs and such before it went in the oven, so do you add anything out? This is just the garlic all mashed up?
That's just the garlic, all mashed up.
So no butter,
no butter.
I love it.
All the good stuff, none of the bad stuff.
That is garlic. But with the other flavors in it, it's great. Just the herbs.
you really don't need anything else. So.
And it's healthy. I mean, if we're going to eat carbs, I guess we have to cut out the butter.
That's right.
Again, pick your battles.
Pick your battles. So we're going to grab a fork and mash that up just to show everybody at home what that looks like.
I mean, because it looks like there's something else in it because of the brown and the black from roasting it.
It really does, but can I use that spoon?
You can.
And it's so easy. Just mash it up. Just smush it.
It's going to be so good. Let me see. Super simple. And again, how long do you roast the garlic about for?
It depends, like 30 to 45 minutes.
Okay.
I usually just go on smell. I'm such a Cajun cook. I tend to just go by like the way it's smelling and the way that it's cooking, and then I'm like, oh, it's just right, or oh, I need to pull that out now because it's been in a little bit too long. So you get the idea.
Yeah.
And this is how it turns out.
And you could put it straight on bread that's just not toasted, or toasted bread.
Absolutely.
Toasting it a little bit in the oven, and just spread it on.
Yeah, that's it. That is all. That's all it is.
I mean, so many helpful tips, and again, spaghetti squash, healthy, no carbs, garlic. We're going to put all of this together when we get back. And of course, go to my favorite part, the tasting. Don't go anywhere. We'll be right back. You're watching Community Cooking. Welcome back to Community Cooking. All right, Abby, my favorite part. Let's dish this up.
Let's do it.
I mean, it looks so beautiful. It's almost too beautiful to eat, but we'll make the exception today.
Yes, we will. All right, so let's dig in.
Oh, so again, spaghetti squash, barely seasoned ground beef that smells delicious, and then the sauce on top.
grab some of this.
Funny thing, you're dishing me out a small plate when I could probably eat the whole thing, but
I
and
know.
then we took the roasted garlic spread and put it on our toasted bread.
Just a little bit more.
Oh
There
my
we go.
gosh.
Now I am Cajun, therefore I believe in feeding you.
Me.
So
Perfect. You'd work out in our Greek family.
excellent. Okay,
All
so
right.
here's your plate.
All right, get yours
And
all
then I'm going to
set.
grab some for me.
I'm going to grab my piece of bread. Look at that. Oh my gosh, it's so beautiful.
And it's good for you too.
I know. Look at me, I'm dying. I'm going to
This
wait
is-
though, because
this is-
that's the proper way to do it.
This is honestly like one of my favorite dishes to make.
Well, and carbs are not bad, but I don't, like I said, like doubling up. So, piece for you.
All right.
All right, I'm going into the spaghetti bolognese first. I got to get a piece of everything. Okay, the teeny bit of seasoning you put in the ground beef comes out. Spaghetti squash, who needs spaghetti? And all the flavors of the sauce, you can tell they were cooking for a couple hours.
Oh yeah,
All right.
it's so good. Okay,
All right, I'm going
now for the garlic bread.
oh,
Mm.
dip a little in my sauce. Okay, one word, yum, all caps.
Yeah. I can't wait for us to eat the rest of this.
I know. We are out of time though, but I really hope you make this at home. Thank you so much for coming in and sharing this fabulous and healthy recipe.
Well, thank you for having me.
So much fun. On behalf of the entire crew, Abby and myself, thank you for watching. And remember, we really do have some of the best chefs right here in our own community. We'll see you next time on Community Cooking.
It's a short ride from your neighborhood to your naturehood. Find fun activities to do, like boating and biking, or camping and hiking, plus much more. To find a neighborhood park or green space near you, visit discovertheforest.org.
Welcome to the South Bay Guitar Show, the show that's all about guitars and the people that play them. And our special guest for this episode is Jesse Damon.
How you doing?
Otherwise known as Tim to me, from back in the day.
Yes.
And you're a local South Bayite, and actually a Lawndale alum of local high school here.
Absolutely. I grew up in Hawthorne and went to Lawndale.
That's what
High.
I was going to say. I think of you and your band as the Hawthorne guys.
Yeah, Rage was the name of us, and it started my career off, and it was with chums of mine, good buds, and everybody wanted to play guitar back then. Right. So it was a lot of fun going to high school parties, going to see bands at school, and also concerts, and it just the bug bit me, and that's I just saw the guys up on stage and said that's what I want to do.
So Rage was your first real band?
It was. It consisted of two longtime buds, E.J. Kearse and Mark Hawkins, who both lived in Hawthorne. And Mark Hawkins and I went to Lawndale, and Mark stayed there for a couple of years at Lawndale and then eventually moved on to Hawthorne to graduate. But he's the one who kind of got me in and taught me a few of my first chords and gave me that bug again. I actually was part of winning a contest when I was 8 years old, and our family got involved and they put my name on it, and when we won a Fender Jazzmaster guitar and a little combo. So I started lessons at age 8.
So you got inspired at an early time.
Yeah.
Wow.
But at that time, I was getting, pulled right and left by friends going, come on, we need you to play outside, and, we're playing football now. Put that thing down. So
hard to give up, so a passion and a hobby.
But it came back in the high school days, so.
Now tell us, I know because I knew you guys back in the day, but tell us a little bit about Rage and some of the things you guys did and how you turned in, the name changed also.
Well, yeah, Rage, we came up with that because we really liked rock and roll, and it was fitting because it was aggressive and it was hard rocking. It just fit our personality of corralling around and raising a little bit of hell. We were a little bit rebels back then too, and so we came up with that name, and kind of had a lot of rivalry bands around the area, but we all respected each other and all supported each other. There was a few times where some of those bands we would be in competitions, Battle of the Bands.
Battle of the Bands.
Yeah,
Oh, yeah.
So that was a lot of fun.
I think you and I were in
probably,
in
yeah.
one of those.
A lot of good friends back then were cheering us on and were happy for us, and we were really serious about it. We really wanted to do it and try and make a go of it as songwriters. And but of course, you have to start with playing cover tunes and playing your favorite cover tunes.
Right.
Back then was Sabbath, Zeppelin,
the standards.
Yeah,
Right.
Deep Purple.
Now I mentioned a second ago the name changed. You guys became Silent Rage.
Yes.
What brought that?
Well, what happened was we were starting to get serious in songwriting, and at a time where we wanted to record our first CD, we investigated and found out that there already was a recording artist named Rage on the East Coast. So we had built a following, and we didn't want to just throw it to the side and start over. So we thought about some of our favorite bands, which was Led Zeppelin, Quiet Riot, Black Sabbath, this soft, hard, soft kind of name, and it fit us and our moniker because we had a little lighter side and we had the tougher metal side or hard rock side. So there also at the same time happened to be a movie that came out in 1982.
George C. Scott.
Well, actually, it was Chuck Norris's movie.
Oh, not the original Rage.
No.
Okay.
So Silent Rage came out, but that was 82, and by 85 is when we really wanted to, and we were ready to change. And so we changed the name in 85, and a lot of things were happening. We met a music producer through another opportunity where the band was involved in the making of a movie, like a cult horror movie, and that producer was Paul Sabu, and he was a catalyst for really taking us down a professional pathway. And he was interested in us. He liked our sound. He came over and listened to us. And so from there we started to just demo with him, and he was out in the valley, so we'd go out there, and we put together probably 13, 14, 15 songs, and now we had an album. So
okay.
Now
I know you brought in some of your CDs here.
Yeah.
You want to give a little show of these?
Absolutely.
Talk a bit
now
about them?
some of these, actually this one right here, this is the second CD by Silent Rage, and the first one was called Shattered Hearts, and it was released surprisingly enough by a company in Hawthorne called Chameleon Music Group. And we had a friend named Steve Brownlee, and he was working at Chameleon, and he knew that he could probably get us a record deal. So we went in and had a meeting, and he had known EJ and Mark pretty good from Hawthorne High School. They had met there, but later on, this was several years after. We're talking 8 years later, and so it was good to have a friend who is involved in the business side, and so we kind of
take it to the next level.
And you also kind of have a little trust there. It's a guy who's your own age, and he's doing his thing, and he's trying to make a go at it. So he was kind of looking after us, and he did. And so from that first album launched, and from that album, which surprisingly enough was like for imports, was in the top 10 for selling over in Europe and in England in 1987. So then came, we wanted to look and really get a major label deal and really launch pad from that first album. So we were looking for management and record labels, and we happened to do a show out in the valley, and it was Richard Marks, who was Glickman and Marks management firm for KISS. And so we invited Mr. Marks to the show. He liked us. To make it a long story short, we gave him some of our material on our first album. He told us Gene Simmons is putting together a new label and major label distribution. I'll pass this on to him.
Now this is a little bit like with Van Halen. Gene Simmons had a part in producing their first LP.
Absolutely. I don't know exactly their story, but I know he did. He did tell us about that too. He claims, and I guess he did discover them, and got them
Certainly
involved
helped
with.
them along.
Yeah, absolutely, and got them involved with getting signed, and Ted Templeman, as their producer and everything. So.
Now you guys really did, I want to say you really did a lot, because you toured and even opened for like Black Sabbath at one point. And
it was a great, exciting time. From this album, which was our second album called Don't Touch Me There, Silent Rage, and we were signed to Simmons RCA. Gene was taking care of us. He had a few different hats on. He was the label president, and he was also managing us. So he was getting us the right agency, booking agency, as well as going in and introducing us to radio, introducing us to MTV people.
It's great that Band Out of the South Bay did as much as what your band did. I mean, that's wonderful.
Thank you.
Now let's take a look at some of the guitars you brought in.
Absolutely. Brought a few from the arsenal here. This is from Don't Touch Me There era, and I was endorsing a company called Conklin. And this is called the Boomerang, and it was specifically made for the Don't Touch Me There tour. And I played this on tour while we opened up for Black Sabbath.
And it has the band's name on the 12-fret inlay.
The Silent Rage there.
That's
so that's a fave one. It's a total 80s guitar. Right. Next one is a workhorse of mine right now. It's one of my favorite Strats. American Deluxe, and
similar to what
I put a new pickup in it. It's a very hot pickup and real strong, solid pickup. It gives me a little bit thicker sound. I also had the Floyd put in it, and love Fenders, so gotta have one. I'm partial to the rosewood fretboard too, as opposed to the maple. This one right here is made by Tom Anderson, and this is a workhorse. This I got back in 1987, and I've had it for Shattered Hearts album as well as Don't Touch Me There. And I've recorded a lot of my solo album with this one. Tom Anderson custom Stratocaster.
Dual humbuckers and
yeah, it's got JB pickups. and it's got the other hot pickup that I had in the other guitar, the same one, with the JB in the neck position. So that's probably the longest standing I've had, and I can't let go of that one. And then I have another one here, which I like, this SG, and I use it for my slide work. Got a Joe Perry slide right here, and anytime I'm doing any slide, I tune this guitar up to open E chord, and it's just cherry. I just love it. So it's a pretty looking guitar.
That came from a special family member, right?
Absolutely. This was this was a birthday gift from my wife Lily, and she just knows how to pick guitars.
There you go.
Because this was the second one she's bought me. All right. And the one that I have right now that I'm wearing, this is the Les Paul reissue gold top. Got it in 2009, and this one is a workhorse for me too. It's I use it. It's probably my #1 guitar. I've taken it on a few different tours in the last 6 years. I played Rocklahoma with it, and I played Europe a few times with it. Played both this one and the Fender for the Firefest in 2011 in England. So
did it come equipped with the Seymour Duncan pickups?
No, I did put these in. These are really nice pickups. I like the sound of them. They're the newer style, and I like the sound of it. So I changed them out. And actually, I got the idea from Gilby Clarke, because I work with Gilby. He produced Silent Rage's 4th album, and he had the same kind of guitar, same reissue, and he had the same style pickup. So I kind of copied him. I'm a copycat, but you know, I like the sound.
Yeah.
So
that's what matters. Well, speaking of sound, I want to give it a go. I'll try to throw down a little rhythm you were showing me.
We're going to do a little rhythm that's famous for my artistry with Silent Rage, and just play a little bit of Rebel with a Cause. So.
Okay. I think I doubled on the B one time, but that's
no
all right.
problem. That was fun, bud.
That's one of your originals there.
Yeah.
Now, do you want to try another guitar, or you want to stick on this?
Absolutely. Let me try another guitar real quick.
Going for the Strat. Now we can see you left the cover back on this one. all springs and back in place? Or do you drop down to 3?
There we go.
Want to try a little heavy riff in A?
Yeah, that sounds good.
All right. Turn it up. Yeah.
Yeah, good one, bud.
That's fun. That's fun. Now, we have an acoustic over here.
Absolutely.
And I think there's something else that you've composed that maybe we could have a listen at.
Yes. You know, all the CDs that I brought today, I have done 4 solo CDs real quick, and this was the very first one. It was The Hand That Rocks. Second one came, it's not here, but it's Nothing Else Matters. And then the third is Rebel Within. And the latest, Temptation in the Garden of Eve.
Now, Jesse, is there a website where people, if they want to acquire these, they go to?
Yes, you can go to jessedamon.com. I have my own website, and you can see and listen to all the material on there. And
there's some downloads they can
absolutely,
preview
all sorts of downloads and a lot of pictures. And
great, great. Okay.
So, a lot of chords, a lot of technical stuff here.
Right. That's all right.
Okay.
Anyone that plays guitar knows that this is what goes with it. Very pretty.
Thank you.
How long ago did you compose that?
That was off my first solo album, and that's called Love Isn't Love Till You Give It Away.
Wow, that's beautiful.
Thank you.
So you're still writing stuff as we speak?
I am. I have a brand new pathway that I took, and it's the genre has gone a little bit different direction. It's still got a little bit of rock in it, but it's really a southern rock meets country blues. And I really, you know, I've been standing in the shadow of the blues for a while. It's been tugging at my heart, and I love it. But, you know, I started off and will always be a rocker. I love rock and roll.
But it's good to grow and expand.
Absolutely. It's
the blues being unlimited. There's
absolutely. And it is, you know, it's peppered in here and there throughout all my artistry with Silent Rage. And I have another band now called Electric Caravan, and a couple guys that are local guys that have been playing for a long time. Kurt Markham on drums and Chris Tenori on bass. And we're a trio right now, but it's a lot of fun to go out and play live. And
you're still gigging the Southland and elsewhere?
I am, yeah. Once in a while I get offers to go, you know, either Europe or, you know, throughout the States, and a lot of Vegas, you know, just wherever the offers come, you know, if it sounds right and it's within my means, yes, I go for it. So,
you know, speaking of the blues, why don't we take it out
Absolutely.
on a little blues jam?
Sounds good. Let me get the guitar on.
Choose your weapon.
Yeah.
Well, Jesse, I want to thank you again for coming in.
Thank you so much.
Ah, my pleasure.
Appreciate
Good to
that.
see you again. Take it in
Thanks so
something
much,
in A.
Jim. Absolutely.
Good.
This lake is long, it's got a lot of shoreline space, it's got a lot of little fingers, little coves that you can get back into and have like a private experience with just you and the people with you. Lots of sandy beaches, lots of places to put out day use, beach camp, and just enjoy watching people go by. We are very passionate about what we do, very excited about being here and offering the services that we provide, and encouraging as many people to come out and enjoy the facilities. It's a beautiful place, and it's a great place to come out with your family and make memories that'll last a lifetime.
kids, we were really lucky. We got to grow up working on the ranch. We got to work in the office. We were exposed to a lot of different aspects of agriculture, which was really awesome. It exposed me to an industry and gave me a lot of different perspective on what I was going to be interested in working in the future. And of course, the obvious choice was agriculture.
When I was growing up, I was told I'm going to go to college, and I figured I would not be coming home to work in the family business. It was, for the three of us, a lot of hard work. My parents never took vacations. They had us work all our summer vacations, after school, especially during Mother's Day when there was a big crop. We'd come in and help. So the thought of actually taking over or actually working for my parents' business was not thinkable at the time.
Over the 40 years that I've been involved in agriculture, I definitely have seen more women get into agriculture and accept more leadership roles.
I graduated from ag engineering back in the 80s, and since then, so almost 40 years, I've been dealing and working with agriculture.
My dad was very supportive of me going to Davis and being an ag econ major, and I sort of just followed his advice, but it wasn't necessarily what I was interested in. I always liked economics. But once I got there and I kind of bounced around theater and journalism and other things that I really liked, I found that I kept sort of falling back into agriculture and into groups of people who were involved in agriculture. And then my skills that I'd built up in theater and communications were good. You know, ag communications is a big deal, and ag policy is a big deal. And so I just was able to find kind of that perfect meshing of my worlds in this position and the positions I've held, and was really inspired by my family.
My favorite part of working in agriculture is being outdoors, watching the plants grow, and helping the researchers solve problems for production agriculture in Monterey County.
I love working in agriculture because I get to interact with all sorts of people, you know, academics, laymen, workers, growers, volunteers, etc., and that gives me a lot of satisfaction, making sure that working with people, interacting with what agriculture provides to you, which is, you know, dealing with plants and soil, feeds my soul. Every day is different because plants, they require and demand different type of tending to them. If it rains or if it's sunshine, whatever, plants still keep on growing, and you still need to tend to them. So every day is not the same as the other.
What I enjoy is I get to work in a family business. I get to be involved in it from more than just the employee stand. So I am actually responsible for 40 other families of employees that work for us. So it really kind of brings me whole with work and family together.
My favorite part of working in agriculture is such deeply rooted in this community, in this valley, of which I grew up in and have the ability to work in every day. Waking up and going into my job, there's so much purpose in agriculture. Every day brings different things to the table. You're constantly learning. The industry itself is evolving and changing. So it's so fun to be able to get to keep the values that were instilled in you, from previous generations, but also learn to adapt to the changing industry. It's really exciting.
Just talking from the programs that I work with, it is very interesting that 90% of the staff, from field workers to directors of the operations, are women.
For women looking to begin a career in agriculture, I would tell them, say yes to as many opportunities as you can, and keep doing those until you've learned what you feel like you have and can from those. Make sure there's someone else to take them, and then say yes to the next level. I think that it's really important that we as women believe in ourselves, that we can continue to learn and grow. I think it's important that you never get completely comfortable, that you really continue to challenge yourself.
Agriculture itself entails a lot of long hours. It takes patience. We have to anticipate what Mother Nature will bring. There's a lot of risk involved. We accept that because we've been doing it so long. If that's not in your palate, then it's probably not for you. It's not a guaranteed way of living. We actually can do it, and we've proven that we've done it. I look at my 40 employees as employees with families, and I protect and actually promote those families as well. And I have to basically make this business work for not only my family, but also their families.
I would tell other women who are starting their careers in agriculture that the possibilities are really endless in this industry. The industry is changing and it's really evolving every day. A lot of people think that being involved in agriculture means that you actually have to be involved with the production or the harvest activity every day. That's not the case. There's so many external things that agriculture touches, and there's so much opportunity to get involved. We're talking about policy making, we're talking about ag education, we're talking about teaching. Like I said, the possibilities are just endless. I would encourage all young people, especially women, to just get out and get involved and find those things that really speak to your heart and you have genuine interest in.
Well, early on, I would say the biggest challenges to women in agriculture was that there were so few of us. And so that meant that there weren't very many role models or mentors, and that's very important to anyone who needs to get into their career.
Some of my female role models in agriculture would definitely have to be my grandmother, my mom, and my aunt. I mentioned being able to ride along with my grandfather at an early age, but my grandmother was right there alongside him getting the farm started all those years ago. That was really unique for that time. She had equal say and she was right there alongside. And again, my mom and my aunt, they were out in the fields too, just like my uncles, helping move pipe, driving equipment. And that was a really powerful message that was instilled at me from a really young age as a young woman, that there was nothing that was too difficult to overcome and that they had really paved the way for opportunities for myself and other female members of not only our family, but of female members of this entire valley and community to get involved in our industry.
Mentorships are very important, and I've had wonderful mentors that are men and women, but since this is about women, I'm going to call out a few of the women. There are people in your life who open your eyes to experiences and ideas that you would never have come across otherwise, and also who see you and see your potential and really just support you to others. They give you some of their positional power and bring it so that you have some of what they have. And there are people like Darlene Din and Lori Coster, Kay Felice, just wonderful women in our industry who have believed in me and have done that for me. And I really think that I and other women need to really be thinking, as this next generation comes through, we need to do that for them.
For the future, I would say it's just wide open. I mean, there's so many different avenues that women can get involved in nowadays. I think maybe technology is one area that women would be excellent at.
Something that I've been in touch all my life, this type of mantra that we need to feed our three parts of our person, physically, mentally, and spiritually. And that's why I decided agriculture does it for me, and I hope it does it for a lot of you.
Monterey County is the best place to live. You can't beat it. And I say raising a family here is ideal as well. I wouldn't have given this up for anything.
Awkward. Do I look familiar? I should. You might remember me from here. Here. Or maybe even here. But an awkward silence can be a great thing. It can actually be a perfect moment to reach out to a friend and ask if they're okay if they seem down. Doesn't matter how you say it.
You all right?
Everything's okay?
All G?
You all right, girl? You cool?
You bugging dog.
Just show you're there for them. Go on, Kelly. Seize the awkward.
Hey, you haven't really been yourself lately. Are you okay?
Find out how you can help a friend with their mental health at seizetheawkward.org. Awkward. Do I look familiar? I should. You might remember me from here. Here. Or maybe even here. But an awkward silence can be a great thing. It can actually be a perfect moment to reach out to a friend and ask if they're okay if they seem down. Doesn't matter how you say it.
You all right?
Everything's okay?
All G?
You all right, girl? You cool?
You bugging dog.
Just show you're there for them. Go on, Kelly. Seize the awkward.
Hey, you haven't really been yourself lately. Are you okay?
Find out how you can help a friend with their mental health at seizetheawkward.org.
Play Eric Amarola's Race Day Mix.
This lake is long, it's got a lot of shoreline space, it's got a lot of little fingers, little coves that you can get back into and have like a private experience with just you and the people with you. Lots of sandy beaches, lots of places to put out day use, beach camp, and just enjoy watching people go by. We are very passionate about what we do, very excited about being here and offering the services that we provide, and encouraging as many people to come out and enjoy the facilities. It's a beautiful place, and it's a great place to come out with your family and make memories that'll last a lifetime.
As kids, we were really lucky. We got to grow up working on the ranch. We got to work in the office. We were exposed to a lot of different aspects of agriculture, which was really awesome. It exposed me to an industry and gave me a lot of different perspective on what I was going to be interested in working in the future. And of course, the obvious choice was agriculture.
When I was growing up, I was told I'm going to go to college, and I figured I would not be coming home to work in the family business. It was, for the three of us, a lot of hard work. My parents never took vacations. They had us work all our summer vacations after school, especially during Mother's Day when there was a big crop. We'd come in and help. So the thought of actually taking over or actually working for my parents' business was not thinkable at the time.
Over the 40 years that I've been involved in agriculture, I definitely have seen more women get into agriculture and accept more leadership roles.
I graduated from ag engineering back in the 80s, and since then, so almost 40 years, I've been dealing and working with agriculture.
My dad was very supportive of me going to Davis and being an ag econ major, and I sort of just followed his advice, but it wasn't necessarily what I was interested in. I always liked economics. But once I got there and I kind of bounced around theater and journalism and other things that I really liked, I found that I kept sort of falling back into agriculture and into groups of people who were involved in agriculture. And then my skills that I'd built up in theater and communications were good. You know, ag communications is a big deal, and ag policy is a big deal. And so I just was able to find kind of that perfect meshing of my worlds in this position and the positions I've held, and was really inspired by my family.
My favorite part of working in agriculture is being outdoors, watching the plants grow, and helping the researchers solve problems for production agriculture in Monterey County.
I love working in agriculture because I get to interact with all sorts of people, you know, academics, laymen, workers, growers, volunteers, etc., and that gives me a lot of satisfaction, making sure that working with people, interacting with what agriculture provides to you, which is, you know, dealing with plants and soil, feeds my soul. Every day is different because plants, they require and demand different type of tending to them. If it rains or if it's sunshine, whatever, plants still keep on growing, and you still need to tend to them. So every day is not the same as the other.
What I enjoy is I get to work in a family business. I get to be involved in it from more than just the employee stand. So I am actually responsible for 40 other families of employees that work for us. So it really kind of brings me whole with work and family together.
My favorite part of working in agriculture is it is such deeply rooted in this community and this valley of which I grew up in and have the ability to work in every day. Waking up and going into my job, there's so much purpose in agriculture. Every day brings different things to the table. You're constantly learning. The industry itself is evolving and changing. So it's so fun to be able to get to keep the values that were instilled in you, from previous generations, but also learn to adapt to the changing industry. It's really exciting.
Just talking from the programs that I work with, it is very interesting that 90% of the staff, from field workers to directors of the operations, are women.
For women looking to begin a career in agriculture, I would tell them, say yes to as many opportunities as you can, and keep doing those until you've learned what you feel like you have and can from those. Make sure there's someone else to take them, and then say yes to the next level. I think that it's really important that we as women believe in ourselves, that we can continue to learn and grow. I think it's important that you never get completely comfortable, that you really continue to challenge yourself.
Agriculture itself entails a lot of long hours. It takes patience. We have to anticipate what Mother Nature will bring. There's a lot of risk involved. We accept that because we've been doing it so long. If that's not in your palate, then it's probably not for you. It's not a guaranteed way of living. We actually can do it, and we've proven that we've done it. I look at my 40 employees as employees with families, and I protect and actually promote those families as well. And I have to basically make this business work for not only my family, but also their families.
I would tell other women who are starting their careers in agriculture that the possibilities are really endless in this industry. The industry is changing and it's really evolving every day. A lot of people think that being involved in agriculture means that you actually have to be involved with the production or the harvest activity every day. That's not the case. There's so many external things that agriculture touches, and there's so much opportunity to get involved. We're talking about policy making, we're talking about ag education, we're talking about teaching. Like I said, the possibilities are just endless. I would encourage all young people, especially women, to just get out and get involved and find those things that really speak to your heart and you have genuine interest in.
Well, early on, I would say the biggest challenges to women in agriculture was that there were so few of us. And so that meant that there weren't very many role models or mentors, and that's very important to anyone who needs to get into their career.
Some of my female role models in agriculture would definitely have to be my grandmother, my mom, and my aunt. I mentioned being able to ride along with my grandfather at an early age, but my grandmother was right there alongside him getting the farm started all those years ago. That was really unique for that time. She had equal say and she was right there alongside. And again, my mom and my aunt, they were out in the fields too, just like my uncles, helping move pipe, driving equipment. And that was a really powerful message that was instilled at me from a really young age as a young woman, that there was nothing that was too difficult to overcome and that they had really paved the way for opportunities for myself and other female members of not only our family, but of female members of this entire valley and community to get involved in our industry.
Mentorships are very important, and I've had wonderful mentors that are men and women, but since this is about women, I'm going to call out a few of the women. There are people in your life who open your eyes to experiences and ideas that you would never have come across otherwise, and also who see you and see your potential and really just support you to others. They give you some of their positional power and bring it so that you have some of what they have. And there are people like Darlene Din and Lori Coster, Kay Felice, just wonderful women in our industry who have believed in me and have done that for me. And I really think that I and other women need to really be thinking, as this next generation comes through, we need to do that for them.
For the future, I would say it's just wide open. I mean, there's so many different avenues that women can get involved in nowadays. I think maybe technology is one area that women would be excellent at.
Something that I've been in touch all my life, this type of mantra that we need to feed our three parts of our person, physically, mentally, and spiritually. And that's why I decided agriculture does it for me, and I hope it does it for a lot of you.
Monterey County is the best place to live. You can't beat it. And I say raising a family here is ideal as well. I wouldn't have given this up for anything.
awkward. Do I look familiar? I should. You might remember me from here. Here. Or maybe even here. But an awkward silence can be a great thing. It can actually be a perfect moment to reach out to a friend and ask if they're okay if they seem down. Doesn't matter how you say it.
You all right?
Everything's okay?
All G?
You all right, girl? You cool?
You bugging dog.
Just show you're there for them. Go on, Kelly. Seize the awkward.
Hey, you haven't really been yourself lately. Are you okay?
Find out how you can help a friend with their mental health at seizetheawkward.org.
Awkward. Do I look familiar? I should. You might remember me from here. Here. Or maybe even here. But an awkward silence can be a great thing. It can actually be a perfect moment to reach out to a friend and ask if they're okay if they seem down. It doesn't matter how you say it.
You all right?
Everything's okay?
All G?
You all right, girl? You cool?
You bugging dog.
Just show you're there for them. Go on, Kelly. Seize the awkward.
Hey, you haven't really been yourself lately. Are you okay?
Find out how you can help a friend with their mental health at seizetheawkward.org.
Play Eric Amarolla's Race Day Mix.